Another question about distribution. Why were residence hall workers in open college halls left out of the COVID vaccination plans? Many of us are working with students in congregate settings and have quarantined many times. Dr. Gifford, can you answer that?
Sure. We have been vaccinating residents and staff of what we call congregate settings. But the definition that we've been using is really those settings where people need some help or some type of supervision with their daily activities of living. So that's things like where some our group homes, where some of our individuals with disabilities live. That's people in residential treatment facilities who have some kind of a chronic illness. So that is the definition of congregate setting that we're using. And other individuals, as the governor said, that are a little bit younger will be a little bit later in our.
All right, Governor Lamont, would you like to weigh in on that one?
No, I think Deirdre answered it well. Thank you.
Okay, Governor Lamont, thank you for taking the time to be with us tonight. We appreciate it.
Hey, thank you for doing this service and clearing up a lot of the falsehoods out there in and around vaccines. You're doing a real service for people. Thanks, everybody.
We appreciate it, Governor. Thanks for your time tonight. All right, coming up here, houses of worship, spreading the word about the vaccine. Ahead here tonight, why that is so effective.
Religion means a lot. Faith means a lot to people.
Plus, the push to get vaccines to colors of communities of color, how a new partnership is bringing the divide, addressing the problem of vaccine access.
I've spent my whole life as a physician. I've seen how vaccines have saved people's lives, saved children's lives, saved the lives of the elderly. We now have that opportunity with COVID. We have a vaccine that's safe. We know this vaccine also, through the most rigorous scientific studies and trials, is effective. We have the opportunity to make a difference. We can only make that difference if everyone gets vaccinated.
At NJM Insurance, making our policyholders happy is what makes us number one. Our customers have rated us first in the nation in customer satisfaction with the auto insurance claims experience, according to J.D. Power. And that makes us happy, too. Experience award-winning customer satisfaction today. This isn't just insurance, it's NJM.
Welcome to Kitchen Cabinet Outlet, the kitchen and bath supermarket. Our showroom is 9,000 square feet. Free estimates and free design help with our 3D mapping technology. Vanities starting at just $1.99. Open 5 days a week in Southington and Waterbury.
As the COVID-19 vaccines become available in Connecticut, be ready and download the Celebrity Shuttle app. Let us take you to and from your vaccination appointment. Bundle your home care and save on transportation with Celebrity Shuttle.
Brought to you by Kitchen Cabinet Outlet, the kitchen and bath supermarket.
As African Americans, we are a lot less to trust the medical community because they haven't been our best friends in the past.
And that past includes the Tuskegee experiments in which syphilis was given to black men and left untreated. That painful history, a big reason why there's a real problem right now with the rates of minorities getting the vaccine.
So far, only about 6.9% of black Connecticut residents have gotten at least their first shot. That's compared with 16% of white residents. Hispanics lagging behind as well at 6.8%.
Another reason for this disparity is a lack of access in urban areas. We'll talk to Dr. Takesha Dwan Everett and Dr. Gifford about that in just a couple of minutes. But first, how does the medical community gain trust of the black population?
Yeah, part of the state strategy, getting the message out through churches in our state. On our panel tonight, Archbishop Leroy Bailey Jr., who is preaching that message at the First Cathedral in Bloomfield. News 8 Shana Ferreira takes us there.
I know that for us, people of color, there's a bad history.
It's a bad history that dates back decades in the U.S. One of the more prominent examples of that, the Tuskegee syphilis experiment from the 1930s. And with stains from current systemic racism still pervasive in the healthcare system, convincing people of color to get vaccinated is no easy feat. In the age of COVID-19, faith leaders in Connecticut are stepping up to the plate.
If the providers will be vaccinated, if those who make the vaccines will take it, then no harm for you to take.
As the pandemic has evolved, national data has revealed Black and brown communities have been hit hardest by COVID. The church is often seen as a firm rock within the Black community, and many recognize the sacred trust and comfort that lives within the Black church.
I want to encourage them because I think it's life-saving. Not only is it life-saving, but there's another scripture that says, do not fear him who can destroy the body, but rather him who can destroy both body and soul.
As many will turn to their pastors and faith leaders for the green light in getting their shot in the arm.
At the beginning, I sort of felt nervous and I wasn't sure if I wanted to take it, but after all, I realized, hey, God is still in control. He's not going to give us money we keep beer, that's for sure.
I said, God, you got to help me. I got to take it.
Getting people of color to follow the science and ultimately follow their faith.
COVID-19 does not have a color code. It's not seeking out Black people or Hispanic people. It's going after everyone. This vaccine doesn't have a color code where it works for white people and it doesn't work for Black people. I believe that God inspires even the scientists, right? God inspires everyone. And I believe that we need to listen to the science. I believe that we need to take the advice of the science. I believe that we need to pray and have faith.
Archbishop Bailey, thank you for being with us tonight. We appreciate it.
Thank you for having me.
Talk to me about how COVID has impacted your congregation.
Well, it has impacted us in a limited form. We haven't had too many people who've been struck by it. We've had a few. But the issue is an issue about fear. And the scriptures teach us that fear leads to death, the death of the spirit, the death of the individual's prowess, this kind of a thing. And what we try to do is encourage people to have faith and to put their trust in the Lord, knowing that whatever they endure, whatever they will inject in, allow to be injected in their bodies, God will make sure that they will be okay.
I have some good friends here who are struggling with some of those same issues. Very deep in their faith, they very firmly believe that the Lord will protect them and they don't need this man-made vaccine. Is that a difficult thing you have to broach with some of the folks at your church?
Well, yes, but it has to do with our preachments. Hopefully they are attended by resurrection results. We preach faith, but we also preach pragmatism. And we ask people to look at the evidence from the scientific perspective, but also to trust that their physicians will give them the proper advice. I asked my physician, both of whom instructed me that it was a wonderful thing to do and a noble thing. As a matter of fact, I had one of our physicians to come and to explain the entire process to the congregation.
Archbishop, thank you. We appreciate it.
All right, I want to bring in Dr. Takesha Dwan Everett, the Executive Director of Health Equity Solutions. Dr. Everett, your organization is partnering with the state to increase access to minority communities. How do you do that?
Yes, so we are working through faith-based networks as well as the educational networks within Connecticut to ensure that individuals who come from Black and Latinx populations have the information they need to have the right decisions, to make the right decisions about getting the vaccine. This includes understanding, one, how we even got to having the COVID-19 virus. What is a virus? How does it work? How does the vaccine work? How do we get to the vaccine? And then ultimately sharing information about when people are eligible and when they're available, as well as where they can go to get the vaccine if they're interested.
Yeah, all that key information. All right, Dr. Everett, what are the main concerns you hear from people who are fearful of getting vaccinated?
Well, early on, we heard a lot of concerns related to hesitancy around that were rooted in the historical links to structural racism, as we've heard about Tuskegee, et cetera. But now, what you're hearing more so than anything is just confusion around when am I available, where can I get it, which vaccine should I get, and really understanding what the long-term effects of the vaccine are. When we have paired community-based individuals such as the Archbishop with experts such as Keith Grant and others, and are sharing with them the information about how we actually got to the vaccine, what the process looks like, you're finding people much more going away from saying, I will not take the vaccine or I'm not interested in it, and more so trying to figure out when am I eligible and how can I find it.
All right, Dr. Everett, thank you so much. Turning now to Dr. Gifford. How important is this partnership with the state making headway in getting more minorities vaccinated?
Well, the kind of work that Dr. Everett described and the work that Archbishop Bailey has been doing with his congregation, that's the type of work that's going to be essential for us to reach communities of color. We understand the history of mistrust, and we understand that open and honest communication and partnering with members of the community and trusted messengers is really critical. So we're so grateful for this type of partnership. We've asked all of our vaccine providers to focus on zip codes in Connecticut where we're not doing enough vaccination, where we need to get our rates of vaccination for people of color higher, and our vaccine providers are pledging to do that alongside of us. So that type of partnership is really going to be what helps us make our vaccine distribution as equitable as it can be.
All right, thanks, Dr. Gifford. I'd like to ask Keith Grant to weigh in on this topic now. We saw you in our video open getting your shot on that rainy day. You wanted to set an example. Weigh in on this for us, Keith.
Yeah, I mean, you know, I recently got asked if Johnson & Johnson was the first vaccine available, would I have taken the vaccine? And the answer is definitely yes, and I'm sure everyone on the panel would agree as well. Before we had the vaccine, every person here was talking about the science of it and how much this is the thing that we've been waiting for. Like, this is, you know, from a science perspective, this is the groundbreaker. And for us to be advocating for it when the opportunity came for us to take it, I think any person or anyone within this group or within the science community would have make themselves available to getting the vaccine as soon as possible. And so I did.
Doctor, thank you. All right, a question on the minds of a lot of parents out there tonight. Will teens be vaccinated before the next school year? Coming up, we're going to ask the doctors and take a look at vaccine trials in kids.
Plus, is it safe for pregnant women to get the shot?
When the vaccine first came out, I was like, there's no data. I don't know what to do.
All right, we'll take a closer look at that after a short break.